I'm Clare Wilkins, and I own the Ibogaine Association in Playas de Tijuana, Mexico, which is about 20 minutes from San Diego. And I'm going to be doing a presentation on screening and safety in Ibogaine patients that Alonso, Dr. Perez, who could not make it, and I put together. And his two main instructions were stick to the topic and don't swear, Claire. So hopefully Dimitri will take up from my slide. All right, so strategies. Preparation, develop situational attention, stimulate teamwork, and compensate for stressful factors. What we do when people first come into the clinic is we are prepared. We make sure we're prepared. Develop situational attention means that we focus on the client and everything that the client needs individually. And then as a team, we work together figuring out how we're going to treat that client. And what we do is we also compensate for stressful factors once they arrive. These are, addicts who are coming in, and you need to be in a state of withdrawal when you're doing Ibogaine, and it's a very scary thing to be going to another country and ingesting an extract of an African root, and also to be climbing to the other side of addiction, to be detoxified. And I remember for me, I didn't introduce myself as a user. For 15 years, I was an IV heroin user, and I was also on methadone for 8 years. And so it's very important for us to make sure that the client feels safe and comfortable and can trust us. That's a picture of our clinic. It's not the best picture, but that's where we are. We do anticipation, planning, optimization, and information. We make just more planning and preparing, and in terms of optimizing, we want to make sure that we accommodate every client's need. Every person is unique, every individual is different. And with information, we make sure that they are provided, that when someone comes, that they know what they're doing when they're doing Ibogaine. It's an intense treatment. A lot of people don't know about it. We make sure that they're informed, educated, that they've done their research. And through all of this, it decreases the morbid mortality and increases the well-being of the patient, and the care quality is much better if you do all of that. The cardiopulmonary function and the psychological state must be evaluated constantly. Ibogaine affects, the cardiopulmonary functions, and it's important that people are healthy enough to do Ibogaine. And so there's pre-evaluation, during the treatment, and then also post-evaluation. We're constantly monitoring. The relationship between the doctor and the patient needs to be a comfortable experience. It's so important that you come to us feeling like you can trust us, because this is we as addicts we don't trust, and so it's really important that for me as a former user that the patients come and feel really comfortable. So what we do is we also do our medical history and our paraclinicals. We do labs and EKGs, and I'll go through the specifics of that later. And then we develop a therapeutic plan, all as a team. We have 5 doctors on staff. There's at least 24 hours a day. There's 2 doctors always. We have a licensed acupuncturist, a doctor of naturopathy, and the majority of the people who work at the clinic have done Ibogaine. Even a doctor, med student, our house cleaner's done Ibogaine. Therapeutic, and that's with no chemical dependency whatsoever, too. So if you want to talk about, people being really intrigued by something that works for other people beyond just addiction, that's pretty fascinating to me. We developed the therapeutic plan as a team, and we obtain the informed consent. Very, 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 very important. The informed consent of the patient, so that they understand everything that they're going to be going through, and that and also for our sake, for business and liability reasons. And we make them sign their, the consent form to leave before they leave if they want to. And we've treated, 1 year and 10 months that I've owned the clinic, we've treated done about 192, 191, something like that. I just counted last week. And so and only 2 people have left, and that's one before she got her treatment and one after. So we're pretty successful in our detoxification. Everybody leaves detoxified. Our main objective, for me, when I did Ibogaine, I didn't really feel safe in the situation where I did it. I didn't have a doctor with me. I didn't have people who spoke English. Fortunately, I speak Spanish, but it really was powerful for me that these people need to feel safe when they're going through this experience. It's like midwifery, you know? Screening. So we first start with phone and emails. We do medical exams, the paraclinicals, the clinical history, and then we develop a treatment plan. Let's see here. The clinical history, we go through everything. When they first arrive, basically, you're under a microscope by everyone, and that includes from the doctors down to, I mean, I've had, you know, the house manager come to me and say, you know, give me some piece of information that everybody has an input. We're all just a huge team that, you know, is constantly observing what's going on so that we can contribute that to the file and to how we're going to be, you know, taking care of the client in the best way possible. So we go through everything, all of their habits, all of their allergies, all of their surgeries, you know, allergies, including food, medications, et cetera, et cetera. The screening process is very thorough. The doctor spends 2 to 3 hours with each client going through everything. Let's see here. We screen the illnesses that compromise cardiopulmonary function, heart failure, coronary heart disease, arrhythmias, pulmonary venous thromboembolism, etc. Active infections, you know, physical examination. This is what we do. The doctors go through everything. I mean, I've had numerous people tell me that that was the most thorough exam I've ever had. There's one of our doctors doing the exam, Dr. Marquez. We look at their general aspect, their color, how they're hydrated, their mental state, nutritional state. Of course, people on Monday, when they're first coming in, you know, we treat a population that's extremely compromised, and because of our, we have a clinical setting within a home. It's a private home. We're fully equipped medically. You know, we need to be monitoring every single thing that's going on. And on Monday, most people are really hurting, and you know, or they're not. They got really loaded before they came, and so we have to wait and wait. Complementary tests. These are the labs and the EKGs. And with the EKGs, the normality in the EKG does not exclude coronary heart disease. There are some abnormalities that lack relevancy in asymptomatic patients. And that can mean that you can have a blockage in a certain part of your heart and we can still treat you. Or you can have even had a heart attack in the past and we can still treat you. Our doctors have studied every single paper that's been published, and we talk to people constantly. We're constantly looking at and improving and looking to see how we can treat people. And we treat some really, we treat a lot of clients that other clinics don't treat. The labs, this is just the list of the labs. I mean, it's pretty thorough. And then, you know, we do customized requests for certain lab things like, you know, cardiac enzymes if we think the client may have sign of ischemia, or pancreatic enzymes. We had a 63-year-old Vietnam vet in recently that had a triglyceride level of 1,300 or something like that, and so we were really afraid for him, and we got his pancreatic enzymes, and he turned out okay. And we got his blood tests every day, actually, and a 63-year-old Vietnam vet was able to come off methadone successfully, which is a beautiful thing. There's a happy guy getting his blood taken. We have great phlebotomists. People are always surprised by how quickly they get the blood. EKG, diagnosis and treatment, just exactly what I mentioned before, what we're looking for. We're looking for acute myocardial infarctions, arrhythmias. We've treated clients with arrhythmias. Just because you've had that doesn't mean that, you know, or you have that doesn't mean you can't get ibogaine at our clinic. You know, there's numerous compromised patients that we treat. That's one of our clients getting an EKG. We had to shave him after that to really get the EKG on the extremities. And we have a portable EKG so that we can take right up to the room when they're in the room. For some clients, we need numerous, you know, EKG monitoring. We have cardiac monitoring, defibrillators, IVs. As I said, it's a very controlled environment. Okay, so as far as the treatments go, how we prepare when you're in the state of withdrawal and you're getting ready to, then you're going to get your IBA and you've been screened, you've been evaluated, you've been approved. We start with the pre-medication. We do a prophylaxis for the gastrointestinal symptoms. One of the two most common side effects of Ibogaine are ataxia and nausea. And ataxia, we can't really control, but with nausea we can. We use a combination of 3 medications that radically reduce the amount of vomiting, and that really, I believe, allows the client to stay in the out-of-body experience and enjoy, or if you can call it enjoy, I believe so, the experience without coming back into your body and having to vomit. There's another theory that vomiting and purging is necessary, so, but this is what we do. Blood clot and PE prevention, heparin, 5,000 units. We also put in every single client a HEP block catheter. This is what it looks like. 5 minutes? I'm almost done. Thanks. And what it is a little catheter that's got a little plastic. It's a plastic catheter so you can move your arms around and everything, and it allows a port for us to administer any medications while you're on Ibogaine, because while you're on Ibogaine, having to try and find a vein and try and do anything that you need to do, that's not really cute. But if you have the HEP block, we can just put it right in. We have the port available. We can administer various medications. We've had to administer atropine for bradycardia. Even they keep the catheter on post-treatment as well, so that we can administer. For the residual withdrawal symptoms, we use NSAIDs that we have in Mexico. We've got a lot of different medications that they don't have in the United States that really help with pain. Or with benzos, people who are benzo patients, or for IVs, people who don't, a lot of methadone clients don't want to eat afterwards. I didn't want to eat, and so, we can do fluids with vitamins and such. They're monitored, the clients. The first and most important monitor is the human observer. We're always watching, like I said. And then we have them hooked up to an oximeter, which just attaches to your finger right here. It's not very invasive. And that monitors the oxygen and the heart rate. And we take vitals as well. We have the doctors coming in and taking vitals as well. I know that this may sound really clinical, but it's in the context of a really loving and compassionate environment. And this comes from me after being a professional patient and being treated, as though, as I was just another, hospital visitor, et cetera. And we really, really, really try and use as much as we can on the safety side, including in a loving atmosphere. So we medicate for the nausea, and then we do a test dose. We wait 60 minutes after the anti-nausea medication, so that everything starts to work, and then we give a test dose. And 30 to 45 minutes after seeing how the client responds, we give our full dose. And the full dose, how we dose, completely also depends individually. We had someone come off methadone with 770 milligrams. We have had someone come off methadone with about 3 grams. So, it depends, and it's all involved with the safety and the team and how we evaluate that. And we've learned a lot, and we all learn a lot from each other. But we all talk to each other. A lot of the providers, have you done this? Have you treated someone with a naltrexone implant? Or, what would you do with this? And it's very important to stay within the community and get answers. There's Dr. Perez, he's back with the client, checking vitals. Right, is there a little pointer thingy?
Yeah.
That's in the oximeter, which shows the oxygen saturation and pulse. God, that's a dark picture, sorry about that. Okay, I'm almost done. We monitor constantly, check blood pressure, extremely important. We had to, if your blood pressure is really high and super, we have to maintain you. And we have the ability to do that. We have the ability, if you have come in with an infection, we're used to lying when we're addicted, and so we want to sound a lot better. Yeah, please accept me for treatment, please. So some people come in with uncontrolled diabetes or blood pressure, et cetera, and so we have to treat that first. This is me with a client. Alex Gray mask on, music happening. It's really important for people to, for us to be there and make sure that because within 45 minutes to 3 hours, depending on the metabolism of the Ibogaine, the withdrawal symptoms decrease. And so we're there looking for that and making sure that's going on. We're looking for lots of things. So these are just withdrawal symptoms. And sometimes I lie with them. And that's the end of my topic. That's the view of from our clinic. Do I have a couple more minutes? Or we're done? No? Okay.
We have time for questions.
Oh, okay, later. Okay, cool.